You know, aging is a process that affects everyone, and some of us age better than others, and some not so well, whatever. But those who don't, you're always looking for something that you can do to help you. And there are different things that can affect us as we age. Dr. Delphine Shannon at Health Fit MD, how are you? It's good to see you again.
I'm good. Thank you so much. Good to see you too.
Let's talk about anti-aging medicine and things like that. What lot that you work with here at Health Fit MD.
Yeah, so anti-aging medicine, or we also like to call it age management medicine, is about helping us to age more healthily and to feel better and have better health as we continue to age. To also avoid, or at the very worst delay, some of the age-associated, age-related diseases and conditions that we're so familiar with in our country. So high blood pressure, diabetes, high cholesterol, heart disease, different types of cancers, Alzheimer's. So bioidentical hormone optimization is something that we do to help people to improve these conditions, avoid these conditions, and live healthier, happier lives.
So basically you're working with hormones, a person's hormones.
Yes.
What are some of the signs? I mean, I see this chart here.
Yes.
If you have any of these symptoms or anything, these can be affected, your hormones can affect this.
Yes, absolutely. So some of the most common symptoms that we hear patients come in complaining of, and for which they receive great benefit, they report with our hormone therapy is fatigue or lack of energy, difficulty sleeping, insomnia, reduced mental focus and memory, concentration. Some people have night sweats, hot flashes, difficulty losing weight, feeling like they're gaining weight without, nothing's changed, but they're gaining weight more now. Right. They may be more anxious or depressed or moody, irritability. Sometimes these conditions like the depression and anxiety is something they hadn't had before, but is just starting, and they're somewhere between mid-30s and 50s maybe, and they've been treated with our traditional medications that we use to treat those conditions, which are not really getting at the root of the problem.
Right, the over-the-counter drugs, there's basically, they're masking it.
Or even prescription.
Yeah, they're masking the problem. They're not helping it.
No, they're not getting at the root of it. No, not at all. And they may only be addressing one symptom of what the root of the problem is.
Wow, that's awesome. So what's the difference? You treat these with hormone therapy. What's the difference between bioidentical and synthetic hormone replacement?
So bioidentical hormones are those that look structurally just like the hormones in our body. So when we take them, our body recognizes them as the hormones that we've always produced. Synthetic hormones are hormones that are made to function like the hormones in our body, but they don't look like the hormone in our body structurally. So when we take them, our body has to convert that into something that it's familiar with, and as it converts it into the hormone that it's familiar with, there's a metabolite or side product that's produced, and that metabolite has often been the cause of a lot of the problems that we've seen in studies that were done.
So, because basically your body is saying, ooh, there's a stranger here, it may have a tendency to fight it, but as you said, eventually it will adapt to it, but there could be some side effects?
With the synthetic hormone?
Well, with either one.
So with the bioidentical hormones, there can potentially be side effects. Usually they're more or less like the side effects that we have as we are hitting puberty, and you start developing your own
a little acne, a little extra hair, things like that.
Potentially things like that.
Yeah.
And we try to minimize those because we have a very methodical way of going about looking at your lab results that we do first and foremost, and your symptoms, and choosing a dose. But still, we could potentially have chosen a dose that was a little high or a little low, and then we will adjust going forward.
But that's why it's better to use the bioidentical hormone replacements than the synthetics.
Oh, much so. Much. There's no comparison in a lot of ways, because the synthetic hormones have been associated with much more serious conditions than just these side effects. So potentially they can increase our risk for cancers, stroke, heart disease, things that are definitely not things we would want to increase the risk for.
Right.
We're trying to do the opposite.
What kind of benefits do patients see after undergoing the bioidentical hormone replacement therapy?
Well,
it's
amazing.
Some of the things they experience.
Increased energy, who doesn't want that, right?
Oh, yeah.
So increased energy, increased strength, increased response to their exercise programs, ability to lose fat and lose weight. They are having better moods and any issues with depression and anxiety get either improved or resolved, better memory and clarity if they were having issues with libido or sexual drive, sometimes even sexual performance. These things are also improved.
Right.
They generally feel younger and happier. I mean, it's been an amazing experience for us because our patients, some of them just like within the first month even just have such great turnaround in terms of their symptom relief that they just feel like new people, and that's always exciting to see.
And that's important.
Yeah.
And I know studies have shown it can help with health protection. Different parts of your body can it helps protect them.
Yes. So one of the major contributors to our increasing risk of heart disease and high blood pressure and diabetes, these things that increase in risk as we age, is because our hormone levels are decreasing, our testosterone, our progesterone, our estrogen. And as these levels decrease, our risk for these different conditions go up. And so when we treat with bioidentical hormones, then we're improving those conditions and reducing that risk and protecting against.
Is there research to back up the positive impact?
Oh yes. There are hundreds of papers on this. It's not as commonly practiced in the United States. I do hope it continues to grow in I guess popularity or commonality.
Right.
But it is commonly done in Europe and other parts of the world.
Well,
so
Europeans have a tendency to jump on things a lot quicker than we do, but that's the great thing. We learn from them. There's nothing wrong with that.
Yeah, we all learn from each other.
And then we'll sit and watch what they do.
Right.
And then we start working with it.
Yes.
And we see here from what it does for the patients.
Yes, and it's absolutely, like you were saying, it's we are very big on evidence-based research, and so we
That's
do.
good.
Yeah, exactly. And so there is absolutely that to back this up, and that's why we offer it.
Well, I guess if you want more information on the bioidentical hormone replacement therapy, hormone optimization for men and women, they can call, make an appointment with you for a consultation.
Yes, exactly. Our phone number is probably going to be on the screen.
It's on the screen
our
right
website
now.
as well.
Phone number, the website.
Yeah.
I mean, you can go on that and you can learn more. Also at BHRTvideos.com and to find out more about exactly how the bioidentical hormone replacement therapy works.
Yes.
That's a mouthful.
I know, you
isn't
got
it?
it out. That was really good, though.
Thank you so much for this great information.
Thank you.
Hey, if you are maybe you're having some of these problems here, any of these symptoms, and you would like to be more like this up here, why don't you give them a call here at the HealthFit MD. Yes. They're located on Highway 49 in Gulfport, about a half mile north of where Kmart is.